Hi, you guys. Welcome back for our daily practice questions. It is day 63, and as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know my disclaimer and reminder is that there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Reminder, we still have some availability for the upcoming 5-week review course that starts April 21st through May 30th. If you're looking to join, grab your space, and the link is also in the description of this video. All right, question number one. A 45-year-old female is diagnosed with Addison's disease. After confirming the diagnosis through lab tests, which of the following is the first line treatment to replace cortisol? Is it A, fludrocortisone? Is it B, hydrocortisone? Is it C, metformin? Or is it D, ketoconazole? Take a moment and tell me what you got in the comments, y'all. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you, right? So here the stem of the question states, after confirming the diagnosis through lab tests, which of the following is the first line treatment to replace cortisol? Y'all, and the first line treatment option is B, hydrocortisone. Question number two. A 55-year-old male patient diagnosed with Cushing's disease is being treated with a combination of surgery and medication. He undergoes a pituitary adenectomy to remove the tumor causing the excess ACTH production. Which of the following medications is commonly used to control the cortisol production if the surgery is not immediately effective? Is it A, methimazole, B, ketoconazole, C, hydrocortisone, or D, dexamethasone? Take a moment and tell me what you got in the comments, y'all. All right, so stem of the question, which of the following medications is commonly used to control cortisol production if surgery is not immediately effective? And the answer is B, ketoconazole. One, ketoconazole is the first line therapy when we're using medication therapy. Ketoconazole is utilized when surgery is not an option. And ketoconazole is used in a scenario just like this when we're trying to control that overproduction of cortisol when the surgery needs time to take effect, so to speak. So when we're thinking Cushing's disease, I want you to think about ketoconazole. B is your best answer, y'all. All right, question number three. A 60-year-old woman with Cushing syndrome due to adrenal adenoma is found to have high 24-hour urinary cortisol levels. What is the most appropriate next step in her management? Is it A, start ketoconazole to reduce cortisol production? Is it B, perform an ACTH stimulation test? C, refer for surgical removal of the adrenal tumor? Or D, begin hydrocortisone replacement therapy? Take a moment and tell me what you got. All right, so the similar question here states, what is the most appropriate next step in her management? So again, this is a treatment style question. So what would you do next? So what is going on here? So you can even think about what you are doing next in the scenario. This 60-year-old lady has Cushing syndrome and is secondary to an adrenal adenoma. Now we see that her 24-hour urine cortisol levels are elevated, right? So we want to manage this thing. So for us in our role, the best answer is going to be C. You want to refer them out for surgical removal of that adrenal tumor because that adrenal adenoma is starting to have effects on the cortisol level. So we need to address the cause, right? So C is your best answer. And I wanted to give you a scenario like this simply because I wanted you to see it in different factors so you know how to apply what you know, no matter how the question is provided to you. So this question can seem like something that you are thinking maybe a little extra or something that you don't do. But if you walk through it, you can see it still leads you to the same thing. We're either doing our ketoconazole or our surgery to treat that Cushing syndrome. So pay attention to what the cause is, the source of the problem, and then you'll be able to decide those first line therapy options for best management for Cushing's, okay? Remember, Cushing's disease is the overproduction. You know, we're real cush because we have the overproduction of cortisol, whereas Addison's is the lack of it, right? We're in a deficit, so our levels are lower, so that's why we need to add it back in, right? So just remember those tidbits as you walk through the Addison's and Cushing style questions, okay? All right, you guys. As always, I hope you found this helpful. Please be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any other resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one, at gmail.com. Everything that I do offer is linked in the bio of this channel, including my website. But if you're looking to book any of my one-on-one sessions, any of my custom packages or plans, I always say either call, text, or email, as I prefer to speak with you first to gauge what you truly need to make sure you're booking the appropriate session type. Okay? All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.